Los Angeles City Health Commission meeting. Please, may we have roll call?
Avila? Grimig? Hisrich? Cotto?
Here.
Mandel?
Present.
Sharp?
Aki.
Vic?
Here.
7 members present and a quorum.
Thank you. Also, let's head on to our next item, approval of the minutes from May 14th, 2018.
So moved. I'll second.
All right, all in favor?
Aye.
Any opposition or abstentions? All right, minutes are approved. Thank you. Anyone here from the Neighborhood Council that needs to make any comments or would like to make comments this evening? Okay. Moving on to public comment. Wayne?
I start off today, I brought an ice drink because I got allergies, severe allergies and heat. Doctor told me to keep hydrated, and they will not allow it in the room. In a health commission meeting, they want you to be unhealthy. That's why I call it the unhealthy commission. That's why this commission is unhealthy. You can't even walk in here at 100-degree heat with an ice drink. You have to be discriminated against as soon as you come in here. But now we learn that our good friend, President Trump, is now elected one of the most conservative judges in the history of mankind. So you can kiss Roe versus Wade goodbye. So you guys are going to have to be ready to deal with that. Now, how are you going to deal with that? What are you Democrats? Because every one of you up here is a goddamn Democrat. You're just too dumb. You gotta be with the party of the schmuck. So what you going to do now? You caused this to happen. You got him elected. You got those 2 Supreme Court picks. You guys. And the reason why, I just explained off the record, because of your fucking Obamacare. You had to have Obamacare over the objection of the goddamn country. So you changed the rules in the Senate, you got rid of the filibuster, and you said, we'll be in power for 100 years. So you rammed Obamacare through. Now what you got is Donald Trump and a Senate of Republicans with 51 votes to pass whatever they want. And they're passing shit like the recent budget. They're going to cut EBT. They're going to cut Medi-Cal. They're going to cut Medicaid. And that means this county's taxpayers have got to make up the difference. That means you have to raise our property taxes. You have to raise our sales taxes and drive more business and more middle class out of LA County. So I want to hear what you suggest to do to come up with the other $100 billion a year we're going to need. And I'll be waiting for that.
Moving on to item number 1, presentation and discussion of Health Commission report by Matt Crane, LA County City Health Commission intern and USC student. Let's first take public comment, and then we will move forward with the presentation. Wayne.
So that's the best we're going to do here today. All the doctors, PhDs. We just had a medical doctor, a genius, by the LA Times, Dr. Patrick Soon-Shiong. All right? Can you get us somebody here to speak to you? No. The only person you can get as a speaker are 2 people, me and an intern student at USC. That's the best you could do, because nobody wants to come here. They don't know who you are. They don't give a fuck who you are. They know you ain't going to do nothing for nobody. And the reason why is because nobody needs your votes. They're cutting your budget. Your mayor is cutting this commission's budget. Herb Wesson, who sits above you in the chair atop of you, is cutting your budget. And here's the way he said it. He said right over here, now, I look to the Lord to help the people. And I see the homeless.
And I was tired of the homeless being homeless. Every man should have a roof over his head. And I'm going to do everything I can to make sure I stop that problem. Yeah, bullshit, Herb. This is the way it really is. Empty chairs, empty suits, empty promises. No money for anything. And all you got is tents, more tents. Wilshire and Hoover, 400 tents. Sweltering in the heat, defecating on the sidewalk, spreading hepatitis A. And what are you doing? You're looking at me. I don't even have to bring my puppet. This is such a puppet show. I could be the puppet. No, you're the puppets. The puppets of failure.
Mr. Crane? You can come inside and sit at the...
Can you hear me? Yeah.
Not really.
Not really? Is this on?
It's on.
It's on? Okay. I'll speak up a little bit. Hi, everyone. My name is Matt Crane. I'm the administrative intern for this summer. I'm working with Ms. Vick on compiling our report for this year and speaking also with Vice President Mandel a little bit and moving forward. And today we're just going to review what we've done so far as kind of a proof of concept and talk about where we want to go from here and different agencies that we want to reach out to and routes of advocacy. So about myself, since I didn't get to introduce myself previously, I am the president of Red Cross UC. I'm an EMT, applying to med schools right now. So my background is much more clinical. I'm trying to get exposure. I'm here to learn from all of you as health professionals. So I'm excited to be doing this work, and I thank you guys for the opportunity. Let's see. So the main goals that we set for the report are really having a current representation of the health issues, because the prior report, a lot of it is actually outdated as far as, the figures on homelessness, on different public health influences on what the city's urban population looks like. So we'd like to update that with new figures, new graphics, new quotes, etc. And we also want to have an assessment of performance and improvement, because a number of things in the city have changed since last time. As we'll go through it, we'll talk briefly about that, especially when we talk about measure H and Prop HHH and how those are changing the ongoing health landscape that we're working in. And then 3, the policy recommendations are obviously what everything is leading up to with City Council, and trying to make sure that we have a presentation to City Council that we follow through and make sure that whatever we do here today lands an impact with them. And so we're trying to make, especially making those policy recommendations novel and also very direct, easy for them to understand, but also something that they might not have thought about or might not have had the information about previously. So the qualities we're emphasizing is holistic. We're trying to look at all the different social determinants of health in the city. We want it to be current, updated with current figures. We want it to be effective. So we want policy recommendations to actually be more than saying, send more money in this direction. We want them to say, reevaluate X, Y, and Z pursuant to this report. We want to give them the resources they need so they can understand the situation better. We want it to be simple. We want to de-escalate the language a little bit so that it's really an easy summary for them to understand. So this is a super big slide. I'd get in trouble if I presented this at school. But the main things that we talked about in the last report is homelessness, healthy living, and medical services. And the majority of the report focused pretty heavily on homelessness and the different health determinants of LA's homelessness crisis and the public health issues that are really related to that population, because that's some of the strongest advocacy that we can do that some of those messages don't necessarily make it to City Council all the time. And especially if you look at the current Measure H and Prop HHH, there's not a lot of money set aside for a lot of different public health concerns that we've discussed in this room. Aside from that, healthy living relates pretty heavily to food insecurity, exercise, really the availability of resources needed to live healthy and make healthy lifestyle choices. And then medical services was the third section we did last time, relating to the city's healthcare infrastructure, including ACA, infectious disease response, and emergency medical services. So the current progress that was sent out to everybody on the commission, we currently have 4 out of 9 sections of the homelessness section. The entire healthy living section has been drafted, and the medical services we haven't started yet. Healthy living and medical services were the shorter ones last time. Homelessness was much more well-researched and had a stronger background of references, whereas healthy living and medical services focus much more on recommendations. So what we're missing right now is updated data for a few different sections, such as current visitors to the sobering center, and making figures and updating current photos. The additional sections, I think we could have complete within 2 to 3 weeks. Again, what we're doing here is just kind of checking on the progress that we've made so far and evaluating that. So looking at what we've done so far for homelessness, the summary kind of touches on this, but as everybody here knows, public health concerns tie in very closely to homelessness and urban health, especially mental health, substance abuse, safety hazards that accompany living on the streets, and infectious disease concerns such as the hepatitis outbreak that we've discussed. Measure H is the sales tax for homeless services, estimated to raise about $355 million. That kicked in, I think it was October of last year. So far, we'll be looking at the impact of Measure H and also Proposition Triple H, which is estimated to raise $1.2 billion in bonds for the construction of 10,000 housing units. And additionally, we'll be talking a little bit about affordable housing because that's really at the root of LA's homelessness crisis, especially the Costa Hawkins that is currently planned to be on the November ballot for repeal, I believe, and the Ellis Act also, as to whether or not that needs reform and whether that's a public health issue. So Housing for Health is the first section that we did on that, and that is the program that is really a Housing First program started by LA that focused pretty heavily on patients that have the most complex medical needs, really, compounding mental health concerns and physical concerns, and these people need a higher amount of health resources that if they're on the street and they're frequently making ER visits will take a larger toll on the city's health infrastructure. So what this does is putting especially those complicated health situation patients into housing immediately as a Housing First project. And so far, the results of that were analyzed by the RAND Corporation in a 2017 report that'll be emailed out to all of you later. And patients exhibited 1.67 fewer ER visits. Cost analysis estimated that it saved, it cut down costs from $38,000 to $15,000, and with 96% retention. And so far, they've filled 34,000 out of the 10,000 housing units that they're trying to. And that also integrates with the flexible housing subsidy pool, which was actually a recommendation on the last housing report. And what that is it allows for a more rapid, flexible way to fund housing for clients that might not qualify for traditional options. So if clients should be placed in housing to alleviate our health infrastructure concerns, but they don't meet the criteria for chronic homelessness or documented disability, then they might not be able to receive that under the traditional funding, but the flexible housing subsidy pool will actually still be able to get them into housing. And the policy recommendations listed there are what we have so far. Again, the policy recommendations are based off of the RAND Corporation's report as well as developments from last time, and absolutely up for discussion. Continuing financial commitment and engaging community stakeholders to make sure that populations that are placed in housing continue to have avenues of growth and the programming they need with substance abuse, with mental health services, etc. Also examining results by subpopulation. One of the biggest cautions with Housing First projects is that it's been shown that the Housing for Health program so far has been cost effective, but it's possible that that's also a result of the population that it targeted who have very complex health concerns, and that if this was extended to the entire homeless population of Los Angeles, it might not actually save money if we're not cutting down on the taxes of the health infrastructure. We also want to look at expanding the flexible housing subsidy pool for candidates that don't meet those stringent requirements for federal subsidies. The second section we've done so far is sobering centers. Since the last report, we've actually founded a sobering center here in Los Angeles. That is the Dr. David L. Murphy Sobering Center in Skid Row, founded on January 2nd. And the goal is to send serial inebriates to this facility instead of tying up the resources that would otherwise be sent with emergency medical services and hospital services. It has a capacity of 50 beds, open 24 hours a day, open with expectations of 8,000 visits from 2,000 unique people, and so far they've only had 2,400 visits. The biggest challenges that they've faced is integrating with existing systems. So this sobering center is not a walk-in service. People need to be brought here by LAPD, by LAFD, or by caseworkers in Skid Row, meaning that if that communication breaks down, there's a lot of problems with how do we get patients actually here. And that relates directly to publicity and the stakeholder relationships. One of the responses to this has been the Sobriety Emergency Response Unit, which has the fun abbreviation SOBER, which responds to calls directly from outreach workers, police, or firefighters with the nurse practitioner, EMT, and caseworker that directly liaises with the sobering center. And since that was integrated and assists in bringing patients in, there's seen an uptick that began in 2018 and is expected to rise through 2018. We don't have updated figures yet. This is an example of something that's totally changed since the last report and how the city's health landscape has evolved. And our policy recommendations really tie into the challenges that they've faced. And if funds from Measure H, along with County Supervisor Mark Ridley-Thomas, wants to send funds for additional sobering centers. So that is something to consider as well. And bathroom access is the last section of the homelessness section that we've done, and as it's something that we've spoke about in the past in the commission. LA notoriously has worse bathroom conditions than Syrian refugee camps. The WHO recommends a ratio of at least 1 toilet per 20 users, and Skid Row has 9 overnight toilets to be shared by over 2,000 homeless people in a single area of Skid Row. So toilets that are present are frequently broken, don't have toilet paper, don't have baby changing stations, and don't have an area to wash hands. So policy recommendations follow with the pit stop plan that was introduced to the Health Commission based on San Francisco's program under the same name, and also engaging to find areas of availability where we can place mobile restroom units, possibly partnering with community centers or nonprofits in the area. The cost is fairly negligible compared to the funding derived from Measure H and Proposition Triple H. So this is a really strong area of advocacy for this commission, especially given the recent hepatitis outbreak, and it would be extremely concerning if something like tuberculosis or meningitis emerge in the same way inside the city. I'll be sharing another document with Ms. Rosales for distribution, specifically on bathroom access. That was a recent evaluation of it. And the healthy living section that has been fairly complete is, as I spoke about, talks about a variety of different issues that relate to for Los Angelinos being able to make healthy choices and relating to environmental health concerns as well. The issues that we can tackle most heavily relate to food insecurity, which is a major problem of health that extends far past homelessness into lower socioeconomic classes, and tobacco, drug, alcohol availability and use, especially with the recent legalization of marijuana. I know we've had a presentation on that as well. Also concerning traffic deaths and risks of environmental hazards, such as housing near freeways, which we've also touched on. All of which are areas that we can delve deeper into, specifically in this report, and kind of cumulatively bring together the knowledge and presentations of this commission so that we can make some policy recommendations and follow through on those to City Council. And yeah, my recommendation is that we plan on finishing the reports in 2 to 3 weeks. And ideally, I'd like to see individual calls with each commissioner to hear specific concerns and areas of improvement. I think we'd also like to evaluate if the county health department is adequately facing these health challenges, as was the purpose of the commission initially, and find additional routes of advocacy. And right now, I'd love to hear any and all feedback on what everybody thinks and what the best, routes of progress are for this. Thank you.
Thank you, Matt.
Yeah.
Very well put together. And thank you for taking into consideration that previous report and kind of melding it into this current one. But as he said, is there any immediate feedback for him? He would also like to have one-on-one conversations with you all. I'm getting feedback here. I'll fix that. But we also can make it available in other ways. Maybe you want to access it and do your own edits or enter your own comments. So we want to try to figure that way out. So there's more than one way to provide that feedback.
Beginning with Dr. Mandel, I have some comments, but I'd love you to go first.
All right.
I think it was a wonderful presentation, and I think the initial aspects of the draft report is stellar. And I appreciate the fact that you sent it to at least the leadership of the council commission so that we could have input already. I've sent some input addressing 3 areas of concern that I have. One is we were presented to about a year and a half ago from the UCLA School of Nursing, which runs a clinic in Skid Row. The possibility and request that funds from HHH and H would be able to support clinics or expansion of those clinics. So not just the UCLA one, but other clinics that are currently on Skid Row, like the Weingart Center. And that ideally we should advocate for funding because obviously there is a health issue of the homeless. In addition to food insecurity, we were presented here, I think 3 months ago, about food insecurity, and the 2 experts who were presented to us pointed out that the number one cause of food insecurity is actually costs of residential homes and or apartments, so that until we address that, there is limited capability of what we could do in addressing food insecurity. So I think that the same thing with those funding for HHH and H. One should think about not just homelessness, but preventing homelessness, and how can we support adequate housing and stabilized rents. And then the other area that I have concern about is data collection. And I think, Matt, you've done a great job in presenting resources to us, but we've been presented to numerous times from the fire department and paramedics, and as well as from Vision Zero. And my concern is, as recognized by the leadership of the fire department and paramedics, that they're not being given the best information about where there are injuries occurring. And it's quite apparent that the Department of Transportation is clueless to where accidents are really occurring. The data that they have is very limited. It's not given to them by city council offices. It's not given to them by insurance companies. Every single injury accident required by California law has to be recorded with the insurance company. It amazes me that the state of California doesn't have a way of getting that data to individual cities or counties. I mean, it's lunacy. Now, clearly, that's a state issue, but being that we're the largest city in the state, one would think that our city council could ask the representatives in Sacramento, both our state assembly members as well as our state senators, to look at this issue. It should be something reasonably easy to address, and potentially carry legislation in Sacramento that would allow the insurance commissioner to get the data, which then could be given to every single county and or city in the state of California. But thank you for what you've been doing. It's quite impressive what you've done already, and we look forward to working with you.
Thank you. Commissioner Sharp.
Thank you, President Vick. Mr. Crane, want to acknowledge the hard work you've put in to date. Obviously, it must reflect that you share the first name with Commissioner Grimmick, another esteemed member of this panel. The suggestion I have, President Vick, for the use of this time is that we try to make some high-level editorial suggestions to facilitate Mr. Crane's process, and then, as he suggested, he follows up with persons regarding specific matters, such as a number of good suggestions that we just heard from Dr. Mandel. My 2 sort of larger editorial suggestions are, one, that we make the task a little easier by potentially confining the subject matter to things that have come in front of us in the last time since this was addressed. And I think that leads to one section being dropped off entirely because it hasn't come up since. And it's also a section that would require a lot of work to chase down the details. That's the housing for health section. That hasn't been heard here since the report. And just given the complexity of that issue, I would suggest that we provide direction to limit that follow-up. On the other editorial choices, I think it'll be easier to sort of pull it together and make something that achieves the objectives you described in terms of being actionable and relevant and so on. By just picking a recommendation or a data point, I think the comprehensive outline that you've begun will be very, very difficult to fill out. Just my experience being here and doing different professional work, interacting with the city, it's going to be hard to get all the information. So I'd love us to be able to provide him direction to pick a recommendation within each of these where there may be some activity that could be more easily tracked in terms of either something the city council or the county has done. For example, the sobering center is a really good one. There's been action on it, and you were able to pull that into a clear and concise summary of what's happened. We could do that with some of the other sections by just narrowing down a little bit. That would help. Then the other question I have for the group to provide feedback on is there's two other subject areas that have been discussed a bit here that were not part of the previous report. And so my question to the commission is whether it merits some attention to acknowledge the enormous number of meetings in which there was discussion of oil extraction and its potential health implications. That wasn't addressed in the 2016 report. Since then, it's been talked about a lot here. And so I guess my suggestion, which I'd like a group reaction to, is that we craft some sort of recommendation that becomes the basis of a small section, again, tighter, easier to secure, that would use the data that the county public health department published, establishing their view 6 months ago approximately, that there is the evidence for a buffer zone, which was discussed here over and over again, right? Then the other subject area that came up a little less often, but again wasn't in the 2016 report, so you wouldn't have it to work with the template, has to do with air pollution and the proximity to freeways, residences. There was, I think, 2 different meetings where we had speakers and discussed that, and we took an action in terms of a motion requesting something from the City Planning Commission and the commensurate City Council Committee plug. The suggestion I make is that, again, we acknowledge that we did that, and in succinct form provided to you in some way that you could incorporate in here and use that to replace a couple of the other section areas that were in the 2016 report, which I acknowledge you've struggled to get details on and which we haven't talked about since, and so I think it's a swap. That would be my suggestion, and I'd love to hear reactions to that.
Yeah, I don't think it has to be swapped, actually. He's done a lot of good work. I think it could be additive. The other thing I think that we should do is have at least one appendix that includes all the agenda that we've had for the year so that it's available, just so it makes it easy for anybody who's looking at the report, so they'd see who presented and what the topics were. That would be very easy just to download from the city clerk and upload it right into your document. It should be pretty easy to do.
Okay. Mr. Rich?
State legislature to change that. And in fact, the county is supportive of those efforts. There is some political resistance from some medical groups and so on, but it would be an important consideration, because if the firefighters can make the determination and take them directly to either a mental health facility and/or a sobering center, it would, I think, make quite an impact. And then in seeking where to put other sobering centers, we've mentioned this before, but for example, the San Fernando Valley is a location that sometimes gets overlooked and has a substantial number of folks that could benefit from that availability. So, but this is an excellent summary, and I appreciate the fact that you're working on it. If I can be of help, I'd like to. Thank you.
Thank you.
Any other comments or suggestions for Matt? Commissioner Kato?
Yeah, thank you very much for your all the work that you put into this report. I know Commissioner Sharp is wanting to limit the items, but you know, one of the things that hasn't been discussed in the area of homelessness, it's another program, a Safe Park LA, and you know, it's a one-step program, but you know, I'd like to see an inclusion of that in the homeless section. And also, when you were, and I agree that, you know, we should include things about the oil fields in the buffer zone and the air pollution, the apartments' proximity to the freeways. Would we incorporate that like in healthy living, or were you thinking of having a separate section? This is my question to Commissioner Sharp.
I defer to our esteemed administrative intern on the organizing of this document. He has put much more thought into that than I have, and so I certainly defer to his recommendation on how to manage the content.
I think, given that it extends past the issue of homelessness, it would lean more towards healthy living, especially with housing proximity to freeway and the oil fields buffer zone issues.
Commissioner Cotto, if I may address your remarks that were addressed to my remarks. The editorial suggestion I'm trying to make on homelessness, I guess, comes from a different place, which is that there are lots and lots and lots of documents now about homelessness. And they are long. I received one last week from the Downtown Women's Center, who came and presented to us at one point in the past, an esteemed organization nearby, 60-some pages of analysis of recommendations of different parts of what's happening. The counties, the Joint City-County Agency, LAHSA, has put out a very long report. United Way just did something about 2 weeks ago. There's just an enormous amount of content about each of these valuable strategies, all of which I think we all support. And what I was trying to imagine is that what might be produced by the Health Commission would be a smaller list of subjects that have been discussed by the Health Commission. I don't dispute that we could endorse a long, long, long list of things that need to be done, and that may, as you're identifying in terms of Safe Park LA, be helpful to council members that are trying to do very difficult work to push forward valuable initiatives. I was trying to think editorially, is there a consistent thread throughout the document? What I'm trying to propose is stuff that was discussed here.
Yeah, we'll take a look. We'll see what we can do on that. And definitely taking into consideration your point about sort of thinking about condensing and being a little more concise and to the point about some of these issues. But we'll definitely, I wrote down your point, Commissioner Kato. We'll take a look. Definitely taking into consideration your time, which I greatly appreciate and we greatly appreciate. Any other comments? No? Thank you.
Thank you.
Okay. Moving on to item number 2, discussion and or action regarding commission vacancies. I have 3 comment cards here. Adam Cohen.
Good evening. My name is Adam Cohen. I am the Director of Advocacy and Policy Research for AIDS Healthcare Foundation. I wanted to inform the Health Commission that the President of AHF, Michael Weinstein, has sent a letter to Herb Wesson calling on the City Council and the Commission to kind of ensure that they're adhering to all of the ordinance's standards. And are you an undergrad? I wish I was as impressive as that young gentleman over there when I was his age. Keep going, keep going. I just wanted to ensure that items that are brought up as soon as possible, and I'm happy to see that there is going to be a report put together, and I'm also happy that on the discussion is the vacant commission members. So I do want to address the statements, and I have copies that I can give to you later, to appoint the 15 commissioners, make sure that report is not only published, but also discussed at City Council. I know that the 2016 report, as of at least last month, had not been presented to the City Council. Publish and present an evaluation of health goals is part of the requirement. Review and present a sample of health service contracts between the City and County of LA, and present those evaluations, and attend government meetings, pertinent government meetings that address health policy relevant to the city. I think that these are serious topics that need to be addressed, and as the state of our country's health declines seemingly perpetually, I do call upon the City Health Commission to do everything in its power to spread good public health promotion and disease prevention. Thank you.
Thank you. And Mickey Jackson?
Hi, Mickey Jackson. I'm with Healthy Housing Foundation, AHF. Hi, everyone. I wanted to talk a little bit about what we've been doing on our own, and what AHF has been doing in Healthy Housing Foundation to try to get a better situation for people. In the report, we heard, conditions are worse than they are in refugee camps. Well, I was at the SRO hotel AHF bought, the Madison, this morning, and I think that's probably true. It was incredibly hot already. I was there yesterday as well. It's very, very hot. People are sitting on the sidewalk in that heat. It's inhumane. And what we have done is, since last October, we have bought 3 buildings. We're working on another 1 or 2. We find that these SROs are typically almost empty all over the city because of land speculation the owners are engaging in. So the Madison, over 200 rooms, only 80 occupied. The King Edward, 150 rooms, only 40 occupied. There are literally thousands of rooms in SROs that are unoccupied in Los Angeles because of real estate speculation, and we need to do something about that. Some cities have instituted vacancy taxes. I also, I just want to tell you, we have brought online since last October, and are bringing online as we speak, close to 400 units, low income. And Proposition, unfortunately, H will not have a single unit, not a single unit, until 2019. So it's obvious what models work best.
Thank you. And our final comment for item 2 is Wayne, who has 1 minute to speak.
How come I get 1 minute? You give the white people 2 minutes. Why am I only getting 1 minute to speak? If you're giving the white folks 2 minutes, why are you giving the black man only 1 minute to speak? It's because you people racist, that's why. Because she talked about Herb Wesson getting a letter from the Jews telling him he fucking up this whole thing, and now you don't want to hear any more rebuttal. If they get some 2 minutes, I get 2 minutes. Look up the Brown Act, motherfucker. The Brown Act say everybody get equal time. Ain't no goddamn rule here say that shit.
Off topic.
They ain't saying that. She talking about apartments while you talking about vacancy. But because they white, motherfucker, they okay. But black man come up here and speak, he get treated like goddamn Uncle Tom. So I want my 2 minutes, motherfucker. Give me my 2 minutes. That's what
Moving
I
on.
want to talk about my 2 motherfucking minutes. And I just want to conclude my thought. Fuck this city.
So, as you all know, we have some vacancies here in our commission. And we have been trying to work through the city council offices to try to get folks seated. We've also done some things where we've worked the other way around, where we've actually recruited commissioners and had them, come in through a different way. Can we turn that down? Does that help? No, it's not helping. So anyway, I just wanted to present to you that I have, is it better? Yeah, it is. Thank you. 'Cause I'm lost on it. Just wanted to let you all know that I have received 4 different resumes from potential commissioners. One is Jonathan Schreiber, who is a leader in community engagement at Cedars-Sinai. I have one from Alonzo Warren. He is a community activist in Council District 9. And there are 2 ladies that are both medical professionals, I believe nurse practitioners from Council District 10. So the ask at this point for me is a couple of volunteers. Perhaps we can get together and vet these resumes and make some determinations as to interview them. We don't really have a protocol at this point of getting commissioners in, but I would like to ask for a couple of volunteers to assist with this process. Commissioner Cato, thank you.
I could be one of those volunteers.
Thank you.
I'm volunteering a shred of experience on this matter, which isn't exactly what you were seeking, but I will share it anyway. In light of the suggestions from Mickey and Adam, I think it intersects. There is an opportunity to use a council presentation to identify for the council members the vacancies. I think there is going to be a fabulous report, hopefully soon. And I think that Adam's right. The City Council must agendize a presentation from you on that report, and that presents an opportunity to list the council offices that have had vacancies. I think the challenge has been getting those council members or the key staff person interested in sending the letter to Candy with the appointment, or Clerk Rosales, as I'm supposed to say. As opposed to, the individuals identified, I'm certain, are, if they're committed to doing this, are likely qualified to do this. If they're willing to come on Monday nights, then I'm happy to have them. I think the challenge has been getting the council offices to do something. Over the last 1.5 years, I've been on a lot of email threads about this. I've spoke to a couple council members. I believe a council member spoke to other council members. Hasn't moved forward, but I think the suggestion that we both take advantage of the attention to the homelessness crisis, which all the council members are worried about in their districts in different ways, as they try to get to 222 new beds, right, in each district, that there may be slightly more attentiveness to a health commission presentation, and that presents an opportunity to just simply list which are the council offices that have vacancy. That would be my suggestion on how to try and take advantage of Mr. Crane's work for purposes of also solving agenda item number 2.
Sounds good. Okay, we'll work that route. But Commissioner Cato, I'm still going to ask for your help. Okay? Okay. Any other thoughts about this item, please? Questions, concerns? No? All right. So it sounds like we will first of all get the report complete, and then we will try to get on the agenda. Well, not try, it shouldn't be an issue. We will get on the agenda, and that will be a point of concern that will be brought forward to the council. Perfect. All right, we have our last item, items for future discussion. Our last comment is from Wayne, who has 1 minute.
So I still don't understand for future discussion. I supposed to get 5 minutes for the items, which is 1, 2, 3, and you only giving me a grand total of 4 minutes. You violate your own rules. Why? Because you don't like the content of the man Herb Wesson has had illegally arrested. Herb Wesson's a fucking nut job. He gets a TRO on a speaker card that's not a threat because he crazy nigger. You got to talk about in the future discussion about having a fucking mental health check on that crazy motherfucker. And there's another crazy motherfucker, her name is Sheila Kuehl, running around the meetings, interrupting speakers, saying she don't got to listen to them. The crazy bitch is on this board getting paid $200,000 a year. So I want you to put her blessing and Sheila Kuehl in a mental institution so I get the fuck out of here and get my soda.
Thank you. Any items for future discussion that we need to address for our next meeting? You know, so the bathroom issue, I'll mention that. Thank you for reminding me. So I had reached out to both Pete White from LA Can and also someone from the city, Elise Matson. And in my conversations with Elise Matson, she was supposed to be here this month. Something happened, not really sure what. So I need to go back and talk to her, and I can have another conversation with Pete White. So we'll just continue to try again. Yes, so I will do that. The other thing is elections of the officers for the commission is supposed to be, if it's not August, it's coming up soon. So I don't remember when, but it's coming up. Right, so we'll just need to double check that. Okay, I'll make a note. Okay. Other items for future discussion? Commissioner Cato?
Presentation about Safe Park LA.
Okay. LA, bathroom issue, election. Any other suggestions? Commissioner Sharp?
I'm not sure it's a presentation, but just an update on the budget.
Okay.
Each year there's varying numbers that are included in the city budget agreement regarding the support for the commission. HF has in previous years generously provided resources to support the commission's work. At one point in time, the city added general fund dollars, then that shrunk, and it'd just be great to know what sort of resources are available for the work, as we have all seen a small number of hours or modest number of hours from someone like Mr. Crane has contributed to a lot of forward movement on one of the obligations that is in the statute. It'd be great to know what other resources may be at our disposal to achieve the other statutory requirements.
Anything else? Okay, well, we're adjourned. Thank you.
You need a motion?
You need
Yes,
a motion to
yes.
adjourn.
I'll
Somebody move.
make the motion. Or
So moved.
Second? Anybody?
second.
All right, all in favor?
Aye.
Anybody opposed? All right, thank you. See you next month.